Welcome to the Learning Center, a place where nurses can learn and discuss the newest and best practices to triage their patients.
Now, we've spent a lot of time reviewing types of difficult callers and how best to manage them. Now let's look at difficult situations. We are going to look at these 4 difficult situations and review how best to handle them. In the U.S., more than 5 children die every day as a result of child abuse. So there's a good chance you will experience a call in which abuse or neglect has occurred. In these situations, you want to get the caller to talk to you and provide as much information about the condition of the child or adult as possible. Using open-ended questions can help get callers talking more freely. Remember, even in these difficult situations, you will need to remain professional, empathetic, and friendly. By doing so, you are more likely to get the information required and help determine if anyone is in immediate danger. If there is, you may need to call 911. Once you've gotten the necessary information about the health status of the child or adult, contact their physician and inform them of the situation. The physician may provide you with additional instructions. Let the physician make the call as to what needs to happen next. What would you do if there was a complicated medical or psychosocial issue or chronic disease? Now, let's see how your answers compare to ours. If the call is a minor acute problem and not a chronic disease, you can use the appropriate protocols for the problem. That's what you're there for. If it's a chronic disease and you have guidelines or protocols for it, follow them. Makes sense, right? If it's a situation for which there are no protocols, call their physician and get directions on what to do. If you are a parent, you know that some of the scariest times are when your child is sick. Parents can get overly concerned and even irrational when their child is hurt or sick, and talking to them can be a challenge. What are some factors that may make a caller even more worried than usual? For many parents, they may not be experienced in caring for a child or in dealing with this particular health issue. Not knowing what is wrong or being unable to understand what is wrong can also make a caller excessively worried and difficult to communicate with. In some cases, a parent may be feeling guilty for something they did or did not do that they think brought on the situation. Being the superhero that you are, your calm, understanding manner, and knowing that you are going to help them through this can help a caller relax. There are many reasons you may be unable to communicate with a caller. Perhaps they speak a foreign language, or are speech or hearing impaired. Or maybe they're under the influence of drugs or alcohol. Whatever the reason is, if you are unable to communicate, ask your supervisor for assistance. It's important that you do all you can to identify the reason for their call and provide protocols and guidance as appropriate. In these circumstances, you will need to try and identify any illness-related issue that may be occurring and follow the proper protocols to address the issue, if possible. If you are not able to communicate properly with the caller, you should contact your supervisor or the physician and have him or her speak to the caller. In order to avoid any serious health issues, if you cannot reach the physician, send the caller to the ER so they can receive care. At any time, you may get a call from someone who is not authorized. It may be friends of a patient looking for help, friends of relatives who are taking care of a patient, adult or minor, or possibly a minor from a participating household. The proper way to handle unauthorized callers depends on the situation at hand. The area to pay close attention to is when callers are not the actual patient and/or the caller is a minor. Friends or relatives who are taking care of a pediatric patient should be handled as if they are the parents. If the child has an injury or illness and needs help, provide it. However, if someone calls requesting information on a sick child, refer the caller to the parents. It is very important that you screen these calls appropriately and do not give information about a child to anyone who is not actually caring for the child at that time. Some minors may call on their own behalf, and that can be a tricky situation. Obviously, you want to remain professional with them and find out what the issue is. If there's an emergency, follow the protocols. If you can speak to the parent, do so. If not, contact the physician and have them speak to the caller. You might think you do not provide assistance to out-of-town visitors who are not actual patients of a participating physician, but that's not correct. You do, however, need to be extra diligent in getting health information and history, and document everything very, very carefully. Refer to the protocols when possible, and urge them to contact their own physician as soon as possible. Some people need extra reassurance. Some are hypochondriacs, and some have issues that are not easily identified. In all these cases, you are likely to find repeat callers. If they call you about the same issue 2 or more times in 24 hours, they are acute callers. It's important to remember that there really may be a serious health threat that they're dealing with, so make sure you thoroughly assess the situation and use reflective listening with many open-ended questions to get them to talk about their health concerns. If no serious issue presents itself, console them and encourage them to make an appointment with their doctor. The chronic callers probably have you in their speed dial as they call you 2 or more times a week. The steps should be easy to figure out. Congratulations! You just completed the training module, Call Procedures. That wasn't so bad, was it? Time now for your post-test to see how much you learned.
Please visit our Learning Center for more videos and articles. Please leave comments and share with your colleagues.